Today, we're going to tackle a really tough and honestly often misunderstood condition: severe, debilitating facial pain. But here's the thing. This isn't just about understanding the pain. What's more important is that we're going to walk through the clear, modern path to actually finding relief.
Just imagine that for a second. A simple, everyday sensation, something you wouldn't even think twice about, suddenly triggering an excruciating jolt of pain. Well, for people living with trigeminal neuralgia, this isn't some hypothetical. It's their daily reality.
Okay, so let's break this down into plain English. Unilateral just means it almost always affects only one side of the face. And paroxysmal, I know, it's a big medical word, it just means these are sudden, unpredictable attacks that come and go. Think of your trigeminal nerve like a complex electrical wire. In trigeminal neuralgia, it's like that wire has a short circuit, causing it to just fire off these incredibly intense pain signals for no apparent reason.
Now, this condition has a very difficult nickname. It's sometimes called the suicide disease. And we only mention that to truly acknowledge how severe, how all-consuming, and how utterly hopeless this pain can feel. And I really want you to hear this, because it's the most important message today, that severe pain is not a life sentence. There is hope. There is a clear, structured path to relief. And understanding that path, that's the first, most crucial step toward taking your life back. So let's walk through it together.
So the whole journey to relief, it all starts with getting a precise diagnosis. This isn't about guesswork, right? It's a systematic investigation to figure out exactly what's going on.
In this flowchart you're looking at, it illustrates the process perfectly. This is the clinical roadmap we're going to follow. It shows every single step, from those first symptoms all the way to very specific treatments. You can see how logical and organized it is. Right after identifying that classic shock-like facial pain, the very first step in diagnosing it is absolutely key.
And that's the MRI scan. This is so critical. It's not just about confirming trigeminal neuralgia. First, doctors have to rule out other serious conditions. But maybe most importantly, the MRI is looking for a very specific cause, a blood vessel that's actually pressing on the trigeminal nerve. Finding this, what we call neurovascular compression, is a major fork in the road that really determines the best treatment path for you.
So once that MRI gives a really clear picture of what's causing the problem, you get to what I call a treatment crossroads. This is where the path becomes totally personalized to your specific situation.
If we follow our roadmap, you can see the first line of defense is usually what's called pharmacological management. Basically, medications that are designed to calm down that overactive nerve. And for a lot of people, this brings some real significant relief. But what happens if the medication just stops working? Or what if the side effects are just too much to handle? This is a really common and totally valid concern. The good news is, our roadmap has a very clear plan for this exact scenario. And here's where it gets really interesting. The path literally splits based on those MRI findings and your own profile. So, if you're a younger patient and that MRI shows a blood vessel pressing on the nerve, the go-to option is often microvascular decompression, or MVD. It's a procedure where a surgeon carefully puts a tiny cushion between the vessel and the nerve. But for patients who are older, or if there's no compression to be found, the focus shifts to less invasive procedures. We're talking about treatments like gamma knife, which uses focused radiation, or other techniques that directly target the nerve to stop it from sending out those pain signals.
Now, I know the idea of any kind of medical procedure can be, well, intimidating. So let's pull back the curtain a little and demystify what actually happens, and let's focus on one of the most common techniques.
All right, let's talk about radiofrequency ablation. You might also hear it called thermocoagulation. It sounds super complex, but the idea behind it is actually pretty simple. A very precise needle is guided to the nerve, and a radio wave creates just a tiny amount of heat. That heat then creates a small lesion on the nerve, which basically acts like a roadblock for the pain signals. It just interrupts them from reaching your brain.
And let me tell you, patient safety is everything. Before anything even begins, there's a super strict checklist. You're made comfortable. An IV is placed so you can get sedation, which is carefully managed to keep you calm and relaxed. A trained assistant is right there with you the entire time, monitoring everything. And every single piece of equipment has been tested and sterilized. It is a controlled, safe environment, period.
You know what's really amazing? It's how doctors get such incredible precision. Think of it this way. Anatomy textbooks, they're the map. But live imaging, like the fluoroscopy you see here, that acts as a real-time GPS. It lets the physician guide the needle to the exact target with pinpoint accuracy, making sure the treatment gets delivered precisely where it needs to go.
Of course, no procedure is completely without risk, and a huge part of this process is having an open, honest conversation with your doctor. You need to talk about potential side effects like facial numbness or jaw weakness, and the possibility that the treatment might not be successful. Being fully informed is absolutely key to making the right decision for you.
Okay, so we've walked the entire path from diagnosis all the way to treatment. Now let's focus on the most important part, what you can do to take control of your own journey, starting right now, today.
If there is one single thing, one thing you take away from all this, please let it be this: start a pain diary. I know it sounds simple, but I promise you, it is one of the most powerful tools you have in your arsenal.
So why is this so important? Well, because all those specific details you track, when it happens, what triggers it, what the pain actually feels like, those are the exact clues your doctor needs. You're not just a patient in this scenario. You are the lead detective in your own case. A really detailed diary can seriously speed up the whole diagnostic process and help your doctor tailor the perfect treatment plan just for you.
And then, when you go to your appointment, diary in hand, you can ask a very specific and very empowered question. Don't just ask, "So what's next?" Ask this: based on my diary, my symptoms, and my MRI results, what does my personalized roadmap, that complete path forward, look like? Look, trigeminal neuralgia is a formidable opponent, there's no doubt about it. But it is not a life sentence. Gaining clarity, understanding the structured, logical steps toward relief, that is how you begin to take back control. Please remember, you are not alone in this, and, as we've seen today, there's always a path forward.